Let's talk about the layers of the small intestine. And there's 5 we're going to discuss: the mucosa, the muscularis mucosa, the submucosa, muscularis externa, and then the serosa. So the small intestine is just a tube. So what we're looking at is the inner portion. So if you take a cross section of a tube, what you're looking at is the inside portion. That's where we're going to find this mucosal area. So we can get on our hands and knees and up the magnification to look at this mucosa a little more closely. So this feature here, and this feature here, this is a villus, villus, villus. All of them together, they're called villi. Small intestine and the mucosa also has goblet cells. So all these white cells are goblet cells, and what they do is they secrete mucus. The very next layer down, right here, is a very thin band of smooth muscle called the muscularis mucosa. And what that does is it helps with peristalsis to kind of push things and move things along. Underneath the muscularis mucosa, we have the submucosa. Sub referring to beneath, so beneath the mucosa. And the submucosa is composed of loose connective tissue that houses a lot of arteries and veins. And directly beneath the submucosa here, we have a muscularis externa. And there's an inner circular portion and an outer longitudinal portion. And then just like the muscularis mucosa, up above the submucosa, this is also smooth muscle. It's smooth muscle because it's involuntary. We don't have control over it. And then down here, right here, that's the serosa. So that's going to be composed of connective tissue and fat. It's essentially just looking to anchor the organ in the abdominal cavity. So what do you think? Are you able to name all of the layers of the small intestine now?